Mike Thompson brought me into the Capitol this morning since I still need a ride. And so I know he's here. Some of the others, however, may be on WebEx. Want to welcome back to committee one of our members who's been out sick, and so glad to have you back, Senator O'Shea. We're going to begin with any requests for bill introductions. Oh, okay. Thank you. I'll try again. I wasn't seeing any of today's testimony online, so I'm going to restart that. And I've said this previously, if you see us on our computers, we're not playing Bejeweled. Maybe that's old. But we are, all of our testimony is online, and so you'll be seeing us following along on our computers. Request for, oh yes, Senator Erickson.
Thank you, Madam Chair. Yes, I am requesting RS 0389, and this is regarding client consent about sharing personal information with social service organizations.
Thank you very much. Is there any, are there any objections to this bill being accepted into committee? Seeing none, are there any other requests for bill introductions? Good morning, Tara.
Madam Chair, members of the committee, I am Tara Mays on behalf of the Kansas Hospital Association. We would request introduction of Senate Bill RS number 0632, a bill dealing with enacting prior authorization processes in the state of Kansas.
Committee, any objections to this bill being introduced? Seeing none, thank you. Any other requests for introductions of bills? Seeing none, we're going to move on to our presentation today. We're beginning with Fred Logan, who's the chair of the Masonic Cancer Alliance Partners. Fred, welcome to committee.
Thank you very much. This opportunity, my name is Fred Logan, and I'm the chair of the Masonic Cancer Alliance Partners Advisory Board. I am grateful as the chair of that board to have this opportunity to submit testimony on the University of Kansas Cancer Center's successful effort to achieve National Cancer Institute Comprehensive Cancer Center designation. And I want to begin my testimony with this. We are grateful, the people of Kansas are grateful for the support that the legislature provided to the Cancer Center in its effort to win that designation. Some of our most outstanding healthcare institutions played critically important roles in the effort to achieve that designation. Those institutions are members of the Masonic Cancer Alliance Partners Advisory Board, Children's Mercy Hospital, Stowers Institute for Medical Research, University of Kansas Medical Center, Kansas State University Johnson Cancer Research Center, the University of Kansas Health System, and University Health. We do not yet fully comprehend the impact the comprehensive designation will have for Kansas. It is my view that the University of Kansas Cancer Center's successful effort to win Comprehensive Cancer Center designation from the National Cancer Institute is the most significant achievement in Kansas public health in the last 50 years. The benefits to public health in our state will be enormous. There will be advances in cancer care and public health that would not have been possible without the KU Cancer Center efforts. Almost 3 years ago to this day, Dr. Roy Jensen, Vice Chancellor and Director of the Cancer Center, and I submitted testimony to the legislature. The legislature had under consideration an appropriation of $5 million to the Cancer Center for establishment of a cancer research and public information trust fund. Here's a brief excerpt of what I said in the written testimony I submitted. Achievement of Comprehensive Cancer Center designation would be a landmark achievement and an important step forward in advancing public health in our state. I advised the legislature that the appropriation would be used to enhance cancer education and research outreach programs for Kansans, and that it would have a lasting, beneficial impact on the lives of all Kansans. I pointed out that the economic impact of winning that designation would be significant. And I then said this, the economic impact is important, but the advance of public health in our state is of paramount importance. With the passage of this legislation, the legislature would take a major step forward in the effort to win NCI Comprehensive Cancer Center designation. That testimony proved to be correct. National Cancer Institute representatives remarked on that legislative support when they reviewed the Cancer Center's application for comprehensive designation. And this past fall, the NCI awarded Comprehensive Cancer Center designation to the University of Kansas Cancer Center. This is an enormous benefit to our state, and it is important to say this. The benefit will stretch across Kansas. There will be research and treatment benefits not only in the urban areas of our state, but in the rural areas and small towns of Kansas. National Cancer Institute representatives made note in their site visit that the Cancer Center serves those diverse areas of our state. The Comprehensive Cancer Center designation will, in my view, make the Cancer Center a national leader in serving people in urban and rural areas and in small town communities. As chair of the Midwest Cancer Alliance Partners Advisory Board, I thank the committee for its support in 2020 for the $5 million appropriation for the University of Kansas Cancer Center. Kansans will reap the benefits of having a comprehensive cancer center in Kansas for many years to come. That completes my testimony. Any questions? Thank you.
Committee, any questions for our conferee, Mr. Logan?
Thank you, Madam Chair.
I have one.
Oh, thank
If
you.
you know me, I usually have at least one question.
Great.
So my question is, will there be fewer people? I've been a health insurance agent for 20 years. Oftentimes, depending on the type of cancer, one has to find Mayo Clinic or Sloan Kettering or MD Anderson to go to. Would this be fewer Kansans that would need to go that far to be able to have those special types of cancer treatment?
Yes, I mean, this, and I think that's a great question to also direct to Dr. Jensen, but as a non-physician who's worked in this effort now since 2016, 2017, it is going to greatly expand the kind of cancer care that's available to our Kansas residents and the people in the catchment area, so that where they might have thought a decade ago, you know, I'm going to go to the Mayo Clinic, I'm going to go to Sloan Kettering. You're now starting to see people come in from other states to the KU Cancer Center. And as we really start to see this develop and blossom, I think you're going to see more and more of that. I think the KU Cancer Center, I can brag in a way that Dr. Jensen won't. I think it's going to be a Mayo Clinic kind of an operation here within a decade. I think it has that kind of promise. And that's what this designation means.
Thank you and congratulations.
Thank you so much.
Now, committee, let's invite Dr. Jensen, who's the Vice Chancellor and Director of the University of Kansas Cancer Center Institute. I'll just begin by saying thank you for inviting us to the gala when you guys rolled out this announcement. Very, very special and pleased to see you there. Welcome to committee.
Yep. Well, thank you for coming. I have submitted my testimony. I'm just going to summarize. But specifically in answer to your question, Madam Chair, when we got started with this effort in 2004, about 15% of Kansans diagnosed with cancer left the state for their care. That figure is slightly less than half that now. So we've made, I think, significant progress. You know, cancer is still the leading cause of death in the state of Kansas. It passed heart disease a few years ago. There are slightly less than 17,000 new diagnoses each and every year within the state, and approximately 5,000 deaths. Now, one of the things that we're most proud of is that we have been able to bring a state-of-the-art level of world-class care to people in this region so that they don't have to travel to some of the institutions that you mentioned. And specifically, one of the most important aspects of retaining folks here is making the availability of phase 1 clinical trials to cancer patients. And that previously did not exist, and I think it's made a major difference in terms of retaining our patients close to home. Now, as we work to build the cancer center that we've envisioned, we always are grateful to the state of Kansas and the legislature in particular. Your support started back in 2007 with an initial $5 million appropriation to the Cancer Center. And this latest $5 million addition to that really was an incredible difference maker for us. We are utilizing this latest $5 million allocation to bring some of the best and brightest cancer physicians and researchers to this state to help build our cancer center, and we're incredibly grateful for that. Happy to stand for any questions you might have.
Committee in the room, and then also any committee members online, do we have any questions for Dr. Jensen? Senator Petty.
Thank you, Madam Chair. And Dr. Jensen, it's good to see you again. I had the privilege, since I'm on Ways and Means, to get to hear your presentation last week. When you talked about the opportunity for Kansans to, or anyone across the United States and the world, to have their treatment for cancer in Kansas, can you share with us, do we currently have, what states do we currently see people coming to Kansas for cancer treatment?
Sure. Right now, it's all 50 states and nearly 20 foreign countries. We have people come in, and a lot of that's driven by our transplant services that we offer, and so-called CAR T therapy, which is one of the latest forms of immunotherapy for cancer, where we actually take the patient's own immune cells, re-engineer them through some molecular biology techniques to essentially teach those cells how to fight cancer. We grow them back up, we put them back in the patient. And we have been a leader in that technology. And in fact, our heme malignancy and cellular therapeutics division director was recently featured on National Public Radio describing the research ongoing at the KU Cancer Center with a new construct that has the potential to really change the paradigm for application of that technique. So it's been really gratifying to see the progress that's being made, and we hope to continue that.
And just one follow-up question. I know that the $5 million has been an important asset, but is there anything that legislatively that we should be looking at this year to continue to help move forward the progress with our cancer center?
Well, I think that, one thing that we're always interested in is making sure that our services are available to as broad a swath of the public as possible. And, frankly, the single most important thing to help make that happen would be Medicaid expansion.
Thank you very much. I agree.
Committee, any other questions? Senator Erickson.
Thank you, Madam Chair. Thank you for being here and for your testimony. I just had a quick question on page 5 of your testimony. You state that the collaboration efforts includes initiatives to increase HPV vaccination rates, as well as developing, testing, and disseminating interventions to increase lung, skin, breast, prostate, and colorectal cancer screening in racially diverse and rural populations. Can you speak a little bit to specifically, if you've gotten to that point, how you, that seems to be a constant theme we hear in this committee is how to reach certain underserved populations. So do you have any specific strategies that you can share that you've talked about or thought about in that respect? Thank you.
Absolutely. And in fact, you know, we're held to account by the NCI for really understanding the problem of cancer within our state and then designing strategies that are specifically focused on addressing the questions you just asked. HPV vaccination is actually a great example of that. A few years ago, the CDC came out with data to show that Kansas actually had the lowest HPV vaccination rate in the entire country. In fact, the map that they showed the rates on, we had to have our own special color. We were so low, which is not a distinction. And when that was announced, we came back from that meeting and put together a task force on how we could turn this around. And that group was led by Hope Crable. It involved folks from all across the Cancer Center. It involved folks from all across the health system and the School of Medicine. And I'm pleased to report that we have made incredible progress, and now we're above average in terms of HPV vaccination rates. And the other thing that I would point out in regards to how important this is, the age group of women that were the first folks where the HPV vaccine was available, the cervical cancer rates for those folks nationwide has dropped 65% since HPV vaccine was introduced. And that really gave people a lot of hope that, you know, we can foresee the end of cervical cancer within our lifetime if we continue to have you know, the uptake of the vaccine grow in terms of as women reach the appropriate age for that. So we're super excited about that. We're always all about preventing cancer, much even more important than treating cancer. If we can prevent it, it's much better for everyone concerned.
Senator Holscher's on WebEx and has a question.
Good morning, Doctor. Good to see you.
Good to be here.
I do have a question. You mentioned, well, first off, congratulations on the developments that have happened with the Cancer Center. I noticed that it sounds like there's great opportunity for excellent jobs and growth in that area. Could you tell me what are the challenges as far as workforce, ensuring you have the staffing, the professional staffing that you need? You did mention Medicaid expansion. I'm curious if there are other things that you see as challenges. And then what's been working as far as attracting those professionals to work at the Cancer Center or other parts of the campus? Is it schools, other things? So again, the challenges as well as what is bringing people.
Well, thank you for your question, Senator Holscher. Actually, it's had a more immediate impact than I would ever have expected. We've had a number of recruits to the Cancer Center within the last few months who have come to us and stated up front that they would not have entertained coming to our institution if we had not received NCI comprehensive status. I didn't think it would have that of an immediate impact, but it's, you know, it was certainly the case for our new vice chair for radiation oncology who came to us from Ohio State University. Dr. White, as it turns out, is probably the leading breast cancer radiation oncologist in the entire country. And, you know, and she is one of those folks that sat in my office and said, I'm glad you got NCI comprehensive designation, or else I would not have come. And so, that's one thing that we're doing. The extra $5 million, frankly, has played a critical role in enabling us to put very competitive offers on the table. As you may or may not be aware, there's a program in the state of Texas called CPRIT, which essentially is a $3 billion program over 10 years that is focused on recruiting cancer researchers to Texas. And, that's what we're competing with, frankly. So we have to be obviously very selective in terms of how we spend that extra $5 million, but I think we've demonstrated with Dr. White and some other folks that we've been very judicious with those funds, and we're attracting some truly outstanding national experts to our center. But that's part of our strategy, Dr. Holscher.
Great.
Or
Thank you so much.
Senator Holscher. I'm sorry.
Wow, I got a question today.
I
That's
demoted you. Sorry about that.
awesome. Thank you.
Thank you, Senator Holscher. Do we have any other questions from the committee in the room or online? Dusty? Nope. Okay. Well, I personally would like to thank you for being here and pleased that we could accommodate you. I know we were trying to find a date and you were speaking to the House committee today. I understand we wanted to try to fit you in today, and I'm glad that we were able to do so. Also, when you and I met before, I shared with you that my daughter-in-law graduated from KU and KU Medical School and is a surgical oncologist at Mayo Clinic in Arizona. And pleased to see, she was pleased to hear of this designation as well. Thank you so much for being with us today in committee. We are adjourned.